Good morning everyone. Myself Ritu and I am student of Western Sydney University and I am doing Masters of Nursing Practice in Western Sydney University, and today I am going to present a presentation on embolic stroke. Here is my student number. It's 22170316. So, in this case study, I will present three parts. First part is the A to E assessment of Mrs. Teresa Milo, and the next one is the high priority nursing interventions, and the third and the final, which medications are we used in embolic stroke patients. First, I have to introduce about the case study of Mrs. Teresa Milo. Introduction. Mrs. Teresa Milo was admitted with atrial fibrillation and has now developed an acute embolic stroke. This presentation applies the A to E assessment framework to evaluate her condition. Nurse's main focus is to significance of vital signs, high priority nursing interventions, and safe medication administration. The goal of the nurses are evidence-based structured assessment to support recovery and reduce complications of embolic stroke according to Part 80 AL 2022. Next is the case summary and the ISBAR of Mrs. Teresa Milo. Identification. Mrs. Teresa Milo, 65 kgs, 145 centimeters long, female, with embolic stroke. And her situation is at the moment she is reduced consciousness. Her GCS is 12 out of 15, which means moderate impairment, slurred speech, and left-sided weakness present. Her background is she was admitted 2 days ago with atrial fibrillation and she was on heparin infusions and discharge plan. Next assessment. Her GCS Glasgow Coma Scale score is 12 out of 15. Her heart rate is 136, atrial fibrillation. Her blood pressure is 180 over 98, which means hypertension is more, and her heart rate is 26 beats per minute. It also increase, and her saturation is 95%, which is just on the borderline. Next is recommendations. Stroke team reviewed, supportive positioning providing, and continuous airway monitoring, Park ETAL 2022. Next is the first is the airway. Her airway is patent on 6-liter oxygens via Hudson mask. Her GCS is 12 out of 15 and slurred speech indicates reduced protective reflexes. No stridor or obstructions present but close monitoring required. Nursing actions is to continuous airway monitoring and suction provided if needed to clear the airway to maintain the airway patent and clear for better oxygenation. Escalate if Glasgow Coma Scale drops more than 2 points. Clinical decision. Prevent hypoxia and secondary brain injury, Brennan et al. 2024. It is very important to maintain the airway of Mrs. Teresa Milo, because if we are not maintaining the airway of Mrs. Teresa Milo, then it is uh, her condition going to very worse than the normal. Next we are going to next part, breathing. Her respiration rate 26 breaths per minute, shallow but equal breathing. SpO2 is 95% on 6 liters of oxygen. She is maintaining saturation 95% on 6 liters of oxygen via Hudson mask, and her possible early atelectasis or fatigue. Nursing actions required. Deep breathing exercises maintain oxygen saturation greater than 95%. Frequent monitoring respiration rate to prevent hypoxia. Rationals. Uh, the nurse's rationale is to optimize cerebral oxygenations to prevent the further brain damage or to prevent any further complications due to the embolic stroke, is according to the Lucini et al. 2022. Next is we are going to discuss circulation. In circulation, her heart rate is 136, is very high, is because of the atrial fibrillation with rapid ventricular response. Now blood pressure 180 over 98 is hypertension, like it indicates compensatory perfusion. Next is capillary refill less than 3 seconds, periphery cools, and pitting edema is present in her feet. Nursing actions, continuous ECG monitoring and BP monitoring to check the atrial fibrillations and blood pressure, and maintain IV access, avoid rapid blood pressure changes. Rational. Both hypotension and hypertension worsen stroke outcomes according to Sensat et al. 2021. Next is disability. Her disability in disability Glasgow Coma Scale score is 12 out of 15, in which the eye response is 4, verbal is 3, and motor is 5, which means moderate impairment. Neurological signs are slurred speech, left facial droop, and left hemiparesis. Pupils are equal, round, and reactive to light. Nursing actions required. Hourly neurochecks like Glasgow Coma Scale, pupils and limb strength, record and escalate changes. Rationals. Detect early deteriorations by checking the hourly neurological orbs or hemorrhagic transformations. Cohen et al. 2022. Next, we are going to explain exposure. Exposure. She is afebrile, no wounds or bleeding. Her BGL level is 5.5 millimoles per liter. That means it's within normal range. IV cannula. She is having IV cannula on her left arm, cubital fossa, running Hartmann's at 20 ml per hour to keep the vein open. No infection signs but edema in lower limb noted. Nursing actions, maintain normothermia, monitor her BGL and inspect skin for pressure injury or any pressure area. Rationals. Fever and hyperglycemia worsens brain injury. Madhu and Ajibe 2025. Next is second part is high priority nursing interventions. First one is the continuous neuro and vital signs monitoring like Glasgow Coma Scale, respiratory rate, blood pressure, heart rate. To Mani ETL 2025, airway and oxygenation. Provide semi-fulvar position or suction if needed. Blood pressure management, gradual adjustment to maintain cerebral perfusion. Sunset ETAL 2021. Early stroke team activation enables rapid neuroimaging and treatment. Madhu and Ajibe 2025. First medication is LT-Place, tissue plasminogen activators assessment. First we have to confirm onset timing, exclude bleed via CT scan, check coagulation factors. Madhu and Ajibe 2025. Administration through IV bolus plus infusion. Blood pressure always less than 185 and 110 mm of Hg. Double RN check Sunset ETAL 2021. Side effect of altiplase medication is intracranial bleed, angioedema, hypotension. Monitor GCS and vital signs. Next medication is heparin IV infusion. Check APPT, platelets levels, administration, controlled IV pump, double verification. Madhu and Ajibe 2025. Side effects, bleeding. Monitor monitor HB level, platelets, and IV sites, MEMS 2025. Next and last medication is metoprolol assessment. Heart rate is always greater than 60 beats per minute. Systolic blood pressure is greater than 100 mm of Hg before giving this medication. Myers and Gulanic 2021 administration oral with food. Monitor vitals pre and post dose. Side effects bradycardia, hypotension. Monitor closely. Do not stop abruptly. Risk of rebound tachycardia present if we stop this medication abruptly. Next is conclusion. A to E assessment prioritize airway oxygenation and BP control. Nursing interventions and safe medication administration optimize outcomes. Evidence-based practice reduce stroke complications. Thank you so much. Next is the references, and thank you.